The broadcast is now starting. All attendees are in listen-only mode.
Hello, this is Dr. Richard Barwell, and welcome to a webinar called the Neuroscience Based Chiropractic Practice. What we wanted to do with this is we wanted to have a discussion with doctors that have incorporated not only neurologically based chiropractic concepts in their practice, but also have been able to bring in the NeuroInfiniti. Whenever we go on displays and go to shows and have the booth, we always get asked really good questions by people that are looking at this but are not too sure about how to bring it into practice. You know, there's a new dialogue that started because of neuroscience over the last 20 years. And truly it's a new concept that we need to be considering within chiropractic, seeing that our primary focus is the nervous system. We have doctors that are online right now. I think Dr. Joe and Dr. Ella, you're there?
Hi, yes.
Super. Hi, Joe.
How are you?
I am fine. Thank you for taking the time. We're going to have more doctors popping on and off. I know that, Dr. Ella, your time is very limited up front here. And so it's you know, we can't sort of work our way through all the slides, but what I want to do is work best as we can with this, but get your stories along the way. The first person I want to just sort of start talking with is Dr. Joe. Doctor, you and I go back a long way. As a matter of fact, one of the first talks I did in Georgia, you were at this talk and saw some possibility about what I was talking about from the neurologically based chiropractic approach. From that, we ended up with the NeuroInfiniti, but I want to get some information, if I can, from you about what was going on in your head when you heard about that shift from the structure to function in neurology at that time.
I just think it was it was a different perspective, because the chiropractors, we always talk about the nervous system. We talk about you know, innate and unleashing innate intelligence, but we've always gone back to you know, X-ray and orthopedic tests, etc. And I think when I heard that talk, the light went on, that just basically saying that, you know, if you're talking about all these things, it would be a great idea to measure them. So I think my epiphany at that point was this could revolutionize healthcare and thrust chiropractic into the forefront. And that really started my, and that was back in what, beginning of 2000, that was January, I think, or February of 2006. And then, and that started my journey with really delving deep into neurology and the impact all of this journey has had on the practice itself.
What happened with, like, you opened up a new practice, you started from scratch at that point, did you not?
Yeah, when I met you, I had just sold my previous practice, and I was in the process of finding a new location, etc. So when I started that new location, I used the NeuroInfiniti. It was just an interesting paradigm shift, opening that new practice and really connecting the dots for the majority of the patients that came in, because I think the congruency of the conversation became very real for the patients as well. So you can connect the dots as to their overall dysfunction, not just their low back pain, neck pain, etc., but you're connecting the dots for the patients as to what's going on with them and why they're having all of these other health concerns too, and then in turn what chiropractic brings to the table to improve that sensory system, that when you improve their movement parameters, get them out of pain by strictly from their perspective, improving their movement parameters, in turn, by default, you're improving their autonomic function as well. And I think that bridge is gapped in the conversation when you're keeping it congruent by showing them what you're measuring, and then in turn where they are, and then in turn from that, as they progress through care, how they're not just their pain is going away, they're moving better, but you're also showing them that how their autonomic system is functioning at a higher level as well, and therefore they're less dependent on medications.
You know, that's one of the challenges that we face with people. They look at it, they love the concept, the chiropractors love it, but they realize that their dialogue is going to change in their office because they've been so stuck on structure up to this point, because that's what we were all taught, let's face it, and in not knowing how to do this. So, Dr. Ella,
Yes.
you're a graduate what year?
Oh gosh, let's see, 2014.
A long time ago.
Yeah, right. It kind of feels like it, but not really. Oh, I still have a little bit of PTSD.
So here's the thing that gets me. You know, when you graduate from college, especially these days, there's not a whole lot that's going on about the shift from the structure to the nervous system. It's just sort of like left there. But you started up in a practice now. I think you did an associateship for what, a year?
Yep, that's right.
And then you went on your own?
I did, yeah.
How long ago was that?
This is my 7th month, so November 1st was my first day. So yeah, this is just entering the 7th month now.
Okay. What happened with you with your communication and your understanding about chiropractic based on the information that you got with neurologically based chiropractic?
I honestly, it put me on fire. You know, just for instance, I did an expo this weekend, and you know, there was 4 other chiropractors there, and they all had been in practice much longer than I have, which sometimes makes you think, oh, they're going to kind of draw more crowds. But I had, you know, I know that I actually brought in about 4 new patients from that just because of my dialogue and my communication. Folks got it. They said, oh, yeah, brain function. And then the fact that I could actually assess it to the level that I can with the NeuroInfiniti just kind of brought it to a whole nother level. And people are really starting to seek that out. And so I think that it really kind of made not only my communication but also my assessment of that patient really coincide. And so that I wasn't saying that I was working with the nervous system and the brain, but not necessarily doing a full functional assessment of that. And so now that I can do that, it really brought a lot of validity to my communication and cleared it out as well too.
Your table talk, how long does it go on?
Like with during a regular appointment, or?
Yeah.
Oh, you know, honestly, you know, a lot of it's just, you know, they, like in terms of education, you know, maybe like a few minutes. I mean, it's not, they just get it. You know, I explain it as brain habits. That's usually my go-to. I say, you know what, your brain's developed some poor habits, and what do we know about habits? They take a long time to really create new habits, right? And so they get it, and they, you know, so before I even tell them their care plan, they're expecting that it's going to be months of work, because they know when you develop a new habit, it takes time. And so now when we talk about that brain and we say, hey, you know, these are those habits that you're not currently doing, your brain's not hitting these brainwave states, they think, oh my gosh, yeah, we need to do that, and they get it. So I don't get those questions like, well, so why aren't you touching over, you know, so they don't question where I'm adjusting, they trust me, and they know that I'm really looking at the overall brain function. And so I don't have to educate them so much as soon as I just do that first adjustment, because they already get it much faster than I found they did when I was talking more about just bones alone.
Dr. Joe?
Yes?
When people come in with, like, say they got, you know, low back pain, the typical thing we see in a practice, how do you get them from getting rid of the pain to taking care of their nervous system?
I'm big on the, personally, I'm big on the consultation, because, you know, you could easily run into a scenario where somebody says, well, I don't understand why I'm taking this test from a patient perspective, so I think it's important to set the table. And during the consultation, I kind of set the table on that of what we're going to be doing today from an assessment standpoint. And then I just basically talk about, very briefly, I talk about you can't, it's physiologically, it's neurologically impossible to separate your ability or inability to move with your ability to control, in our terms, your autonomic nervous system. It's impossible. So that person who has sciatica, low back pain, etc., it's not a coincidence that they have high blood pressure, tachycardia, high cholesterol, digestive dysfunction, etc. They go hand in hand, and then in turn you can't improve somebody's movement without also improving that autonomics. So I kind of briefly go into that. I dumb it down a lot more than what I just did on an introductory. It's like the cliff notes of the cliff notes. So this way we're going to also assess not only your movement parameters, but we're also going to assess your autonomic function through what I kind of rephrase it, I just kind of call it the stimulus response, because I don't want people to think that, oh, well, that test didn't stress me out, because they still don't understand the term stress. So I just call it, right now I'm calling it a stimulus response, because that's more generic, so they're not going to fight it, right, in the understanding of it, because I'm not trying to stress them out, right? So I set the table with that, so this way we can get a complete picture of what's going on with you, so we can set up a protocol to start to unwind you and get your body to function more appropriately.